should health be under the national government? Let's talk about that, because we're also going to be talking about some things that we are seeing in the health sector, and we're really, really worried about. Of course, high on that number here is that we're looking at fake drugs, fake Viagra. Many people will be worried about that. Okay. Fake HIV tests. Even worse, fake ARV tests, fake dialysis, fake condoms.
Yeah.
I mean, for goodness sake.
There are fake condoms back.
Fake dialysis. By the time you need to go get dialysis, your system is already falling apart. Yeah. So what exactly is happening if the levels of creatinine, for example, continue to rise and that flushing doesn't work? And just last week, a woman gave birth outside hospital because they said, well, we can't offer you services because of whatever. We continue to see the disease burden rising. And so we're asking the question. And then apart from that, the brick and mortar of the health system for the last, many days has had a glitch, which I said, if it's 2-3 days, it's not a glitch anymore. It's a breakdown. All of these things are happening at the same time. Is it time that health was centralized?
Thank you so much. Sometimes matters healthcare really break my heart, because healthcare world is really personal, and you fall sick as a person, and the family and people around you handle you and nurse you and experience the pain at a personal level, and we want to make it very private. We are all potential patients, because as long as you're alive, you're going to die someday. If you're lucky, you can die in your sleep without being sick, but most survive without to fall sick or be in a road accident or an accident of some sort. The courage of fire, that courage in Elijah are long gone. Yeah. So we must then ask ourselves that when that time comes that you need that care, whether to recover from or your final care as you go, is the system responsive enough? And I believe that healthcare should have never been devolved in the first place. Or that we live in a country where politics takes precedence over everything. And every time we question the wisdom of why healthcare was devolved, we are told that the teachers fought. Their union fought for them not to be devolved. Where were the doctors? Because the KMA was just talking about when does life begin and whether abortion is a right or not. And it's true that doctors are just trying to speak about science in TV shows. I was young and I could watch it. Yeah. But the teachers were fighting. So then it breaks my heart that the doctors and the unions which didn't exist then didn't fight for this. Nobody saw it fit to fight for it. Yet even those who are making the law knew that they also fall sick. Yeah. Then we go ahead and make this huge mistake of not just devolving it, but devolving it en masse, because healthcare is over 90% devolved. And I remember when President Uhuru then tried to tell the governors to wait, we devolved it in bits so that we don't have to give them the whole thing to handle suddenly. The COG chair, Isaac Ruto for Bomet, was like, no, Uhuru, you are fighting devolution, give it to us. And Uhuru, being the nonchalant guy, was just that, chukweni basi. So healthcare was then devolved without even costing the function. I laughed the other day when I saw Governor for Kiambu finally saying that these costs that are devolved were never costed enough to know that how much is healthcare, how much you need to send us. Because MOH cannot keep 176 billion annually, which is still higher than even the money that the county spent on healthcare nationally, when healthcare is 90% devolved. So they were told, wait, let's cost this thing before you take it, or let us devolve it per county. They refused. They were told, let's devolve level 1 and 2 community dispensaries, we see what you do, then you can add you more functions. They refused. They said, give it to us all. And the long run, who ended up carrying the burden? The poor Mwananchi, who this morning wakes up wondering whether they have to go to work or to go to KNH and kill the